Good day, sir. I am Leslie de la Pasion from BSN22 Group 2. So this video remains the demonstration of the physical assessment of head, neck, and regional lymphatics. And the equipment are stethoscope and the glass of water. And then before we proceed to the procedure, explain to the client the assessment process and inspect the client that you will be touching his or her various areas with different kind of fingers or hand. Good day, ma'am. I am Leslie de la Pasion, your nurse for today. So for today, I will going to assess the your head, neck, and the lymphatic region. So, and is it okay if I will going to use my hands to touch your various areas?
Yes, ma'am.
Okay po. And then provide warm privacy and well-lit room, and use alcohol for infection control. And then next is inspect the shape of the head. Have the client a comfortable position and facing the client with your head at the level as the client's head, and then inspect for the head for shape and symmetry. Okay, I don't see any abnormalities for the head and for shape and the symmetry. And then next is palpate the head. Place the finger pads on the scalp and palpate its surface beginning in the frontal, parietal, temporal, and occipital. And then assess for the contour, masses, depression, and tenderness, and palpate for temporal artery, which is located anterior to the tragus of the ear. And then next is inspect and palpate the scalp. Part the hair repeatedly all over the scalp and inspect the scalp for lesions or masses. And then place the finger pads on the scalp and palpate for lesions and masses. Part the hair. Okay, I don't see any lesions or masses in the hair or in the scalp. Inspect the face. Observe the client's face for expression, shape, or the oval, round, slightly square, and the symmetry for the following structures and the eyes, nose, mouth, ears, and eyebrows. And then note for any swelling, abnormalities, features, or unusual movement. There are no abnormalities, features, or unusual movement for the and then next is palpate and auscultate the mandible. Use the fingertips of both index finger and middle finger to locate the temporomandibular joint anterior to the tragus of the ear on both sides. And then hold the fingertips firmly in place or over the joint and ask the client to open and close the mouth. Observe the relative smoothness of the movement and whether or not the client notices the discomfort. Can you please open your mouth, ma'am? Once again. And then remove the hands and hold the bell of the stethoscope over the joint. And then listen for any sound while the client open mouth open and close the mouth. Open your mouth. And to the other side. Open. And then next is inspect the neck with the head in a central position. Inspect for symmetry of the sternocleidomastoid muscles anteriorly and trapezius posteriorly. Have the client to touch the chin to chest. Ma'am, ganito. And then the side of the each other's shoulder. Sa kabila. And then assess for limitation of motion. And next is note for the presence of stoma and tracheostomy. And then palpate the neck. Stand in front of the client with the finger pads. Palpate the sternocleidomastoid and note for the presence of masses and tenderness. And then next is stand behind the client and with the finger pads palpate the trapezius and inspect for the masses and tenderness. And then next is inspect the thyroid gland. Secure tangential lightning and shine it an oblique angle on the client's anterior neck. And then next is face and ask the client to straight ahead with the head slightly extended. My straight and slightly extended the neck. And then ask the client to sip water for 2 and swallow 2 times. Wait lang. And we use pen light to observe the tangential lightning for the neck and observe the front neck in the area of thyroid and isthmus for masses and symmetrical movement. Can you please drink water, ma'am? And swallow po. And isa pa. Swallow po. So, for the inspection, I don't see any masses and tenderness for the next is palpate the thyroid. For posterior approach, have the client sit in a comfortable and stand behind the client. And then next is have the client lower the chin slightly in order to relax the neck muscles. Ma'am, you can lower your chin slowly to relax your neck. And then place the thumbs on the back of the client's neck and being the other fingers around the neck anteriorly with their tips resting on the lower portion of the neck over the trachea. And then ask the client to sip the water and swallow 2 times. Ma'am, can you sip the water and swallow po? Swallow. And then move the fingertips over the trachea ring and instruct the client to swallow and palpate the isthmus for nodules and enlargement. And then have the client incline the head slightly forward. And then press the fingers of the left hand against the left side of the thyroid cartilage to stabilize it while placing the fingers of the right hand gently against the right side. And then ask the client to sip water, ma'am. Buttercup. And then swallow. And then instruct the client to swallow sip of water, and then note for consistency, nodularity, tenderness as the gland moves upward, and then repeat to the other side. For anterior approach, stand in front of the client, ask the client to flex the head slightly forward. And then place the right thumb on the thyroid cartilage and displace the cartilage to the client's right. Ma'am, can you please straight forward? And then use the right thumb for the thyroid cartilage. And then have the client to sip water to swallow 2 times. Ma'am, can you please? Swallow po. And then repeat the procedure to the other side. Auscultate the thyroid gland. Stand in front of the client and place the bell of the stethoscope over the right thyroid lobe, and then auscultate for bruise. And then repeat to the other side. And then next is inspect the lymph nodes. Stand in front of the client, expose the area of head, neck to be assessed. And then inspect the nodal areas of the head, neck for enlargement or inflammation. And then next is palpate the lymph nodes. Have the client to sit comfortably, and then face the client and conduct the assessment of both sides of the neck simultaneously, and then move the pads and tips of the mandible 3 fingers in a small circles of palpation using gently or gentle pressure. And then follow the systematic routine sequence beginning in the preauricular, postauricular, occipital, submental, tonsillar nodes, and then note for the size, shape, delimitation, mobility, consistency, and the tenderness. And that's all for the demonstration of the head, neck, and the regional lymphatic. And thank you for watching.